Good afternoon and welcome to Dan's seminar. You know what Dan is, I hope so, because you are here. But just let me remind you, it's a not-for-profit organization, it's membership supported, and the mission of Dan is safety of divers, medical safety of divers. We want to make diving injury and free. So you say, okay, are there any injuries in diving? Well, they are rare. You will learn about now, but it's better to be prepared than sorry. So we are here tonight to talk to you a little bit about diving injuries, treatment opportunities, and how to avoid injuries, how to dive safely. Please feel free to ask questions. Every of our speakers will give a brief talk, and then there will be time for questions. In Malaysia, you are lucky because you have so many experts, or at least several top experts in the field of diving medicine. And you are covered well at home. There are plenty of hyperbaric chambers. But when you go diving abroad, it's not the same situation. And that's the role of Dan. We are networking out there. We are creating opportunities to provide you the same treatment as you have at home. So now let's start. Dr. Andrew Ang will talk to you about diving injuries.
Thank you, Dr. Pita. Good afternoon, everybody. My name is Colonel Dr. Andrew. We are all from some of us are previously from the Armed Forces. I'm still working in the Armed Forces. I've been involved with diving medicine for almost 18 years now. So I've been given a topic to talk about for about 10 minutes, the most common dive injury. So there's two parts of it. One is which I'll be focusing more on, which is the dive injury. And there's also other injuries which are diving related, but they are actually classified as non-diving. I'll just go right into it. The first one is barotrauma. So from the word baro, it means pressure. Okay? Trauma means injury. So injury due to pressure. In fact, this is the most common diving injury. All of you are divers here, I think. So at one stage of your diving career, you would have experienced barotrauma, mainly to the ear. In fact, it's one of the first things that they teach you when you take your open water dive, teach you how to clear your ears, how to equalize, isn't it? So this injury is due to changes in pressure, and it must be in an enclosed space. So the most common one is ear barotrauma, or we call ear squeeze. This happens when you dive. As you go deeper, the pressure increases. But you must know where is your dive site. For example, in Sabah, in Bali, you actually have to cross some mountain ranges. It's more than 300 meters. Then the risk of the pressure is lower than sea level, then bubble will develop. So when this bubble develops, it will cause trouble. Okay? That's where decompression sickness is. Depends on the number of bubble, how many, where the bubble is located, okay, and this will then determine the signs and symptoms. Mild one will be pain only, pain at your joint, tingling sensation, feeling very tired after a dive. Those are very mild kind of thing, not really life-threatening. But the severe one, brain, spinal cord, inner ear, this can cause unconsciousness, paralysis, and even death. So it is something to be really aware of, be careful about. So always limit your dive. Remember how much you've been diving, and stay well hydrated, okay, to prevent all this from happening. Later, my colleague will be talking about treatment and prevention of some of these conditions, okay. So very importantly is oxygen to be given. They'll talk more about that, but then have an emergency oxygen first aid course that I would encourage you to inquire at the booth. Ask about how to be an oxygen provider. Okay. The next common dive injury is arterial gas embolism. It's a little bit similar to decompression sickness. It's also due to bubbles, but there is a different mechanism of how it develops. And in fact, this is one of the most feared condition for us dive doctors. Yeah, it can cause immediate death. It can cause severe paralysis. So what happens is that usually there is a situation where the diver panic, for example, run out of air, or maybe see a shark or something, and then the tendency, natural tendency is take a deep breath, isn't it? Take a deep breath, hold your breath, that's what we do on land, and then quickly want to get out of the water, you shoot up very fast to the surface. And what happens with that is that opposite of what happened in DCS is the enclosed space actually expands. So your lungs, if you close your mouth and nose and you hold your breath, your lung is going to expand twice the size, triple the size, and it may even rupture. So when it ruptures, a little bit of gas enters into your bloodstream from your lung. All you need is one bubble going up to the brain, and that's it, you become unconscious. Okay? So we have been taught from the day that we learn diving, never hold your breath, always breathe out. That is the reason. Okay? So that's more or less some short info on common dive injury. There are many others. We don't have time. There will be a whole lectures of any of this. Just going on to the non-diving injury. A few conditions that are pretty common that we see in our day-to-day practice. One of it is heat exhaustion. In our environment, in Malaysia especially, it's very hot, it's very humid, and for people that have not been acclimatized, you're wearing your wetsuit, is very thick. Yeah, even worse if it's dry suit. People from non-tropical climate countries coming over here, they're not acclimatized, they get dehydrated, then they can get heat exhaustion. So patient will present with dizziness, profuse sweating, yeah, tachycardia, that means your heart rate goes up, nausea, vomiting, stomach cramp, muscle cramp. All these are signs that the body is trying to compensate or overcome the overheating, too much heat. Okay? And if it's very severe, it can even get into heat stroke. That's when the body mechanism to overcome the heat shuts down. At that stage, you'll find the patient either unconscious or delirious, talking nonsense, not cooperative, blood pressure start to come down, and you will find the skin to be cold and clammy, no more sweat, because everything has shut down now. All right, and life-threatening. You will shut down the kidney, and it can cause damage to the brain. Okay, so move the patient out to a cool place, get acclimatized, make sure that you are well hydrated. Okay, don't be a hero macho, stay in the sun the whole day.
Thank you, Dr. Andrew. And I hope we didn't scare you because we were talking about injuries. Fortunately, those most severe and dangerous are very rare. But I bet if you are divers here that some of you have experienced ear pain while diving. Can you raise your hand if you ever experienced ear pain while diving? Yes, that's most common, and you can be very good in equalizing, but if you are diving with the flu or cold, you will still experience that. So advice is don't dive with the flu. Many of things that Dr. Eng mentioned here are really just a sketch of it, and for more details you can check that web page and learn a lot about that over there. And of course now I invite Dr. Clement Apollo. He will talk to you about treatment opportunity for diving injuries in this area.
Good afternoon. Thank you for coming for this afternoon session. I'm Lieutenant Colonel retired Dr. Clement. I left the service 3 years ago, but I have 13 years of taking care of divers in the Malaysian military, and also I've been treating divers from all over the world when I was stationed in Kota Kinabalu and Labuan last time. Until today, I'm still seeing divers and treating divers. Okay, so today we're going to talk about the principle of treatment and the treatment opportunity, who and where to call when you are in trouble, and also the need to be assessed by diving doctors. Okay, as Dr. Andrew mentioned, DCS happen when you have too much nitrogen bubbles in the body causing you symptoms. And when this thing happen, you need to go to a reconvention chamber as soon as possible, okay, to get treatment. But before that, there are many steps you need to go through before you even reach the chamber. So in the recompression chamber, this is for us to know, and the reason why we use the hyperbaric oxygen treatment to treat is because there are two components in this. One is the pressure and the second one is the oxygen. Why we need the pressure inside the recompression chamber is to compress the bubbles inside your blood circulation so that the bubble becomes small again and then it can flow together with the blood, and then the blood will bring the bubble back to the lung and you just breathe it out. Okay, so that's the pressure part. And then the oxygen part is the oxygen when you're inside the hyperbaric chamber, the oxygen will go into your lung and then the blood will bring the oxygen to every part of your body and then displace the nitrogen, and then the nitrogen will come back to the blood circulation, and then the nitrogen bubble in the blood will come back to the lung and then you breathe it out. So it works on both ways to treat the decompression sickness. So for diving instructor or yourself who are divers, so what you need to do when you think that you are developing the decompression sickness is these few things here. Number one, hydration. Drink plenty of water to make your blood volume become more so that there are more blood to flow around. Hopefully we can flush the bubble back to the lung and you breathe it out. Okay. Second thing is oxygen. Oxygen is very important because a lot of quite a number of mild cases of decompression sickness, a very light degree of joint pain or some minor degree of numbness, you can probably get away with a long hour of just breathing oxygen if you are in a remote island, instead of coming back all the way, flying from the island to the city and then from the city to travel to the hyperbaric chamber. Okay, and even if it doesn't cure the decompression sickness, but it will still reduce the severity of the disease. So when you get to the hyperbaric chamber, your prognosis is much better, and the number of treatment that we need to do on you may be less also. So either way, oxygen is important. Hydration, oxygen, and bed rest. Bed rest means you should be lying around, not moving much. Okay, so that is what you should be doing. And then you should have a contact for yourself, the diving facilities or the diving doctors. When you go to an emergency department in any big hospital, if you think that you have DCS, the big hospital emergency department may not know anything about decompression sickness. Okay, doctors who are trained in this area, they are specialized and they specially trained to recognize this kind of disease, like the three of us coming from the military, because that's our job to take care of the divers in the military. Okay, so you need to have a contact of your hyperbaric facilities or a hyperbaric doctor, so that if the emergency physician tell you that, oh, this is not the other medical problem, I think it's probably decompression sickness, so go and see them. Okay, at least when the doctor, but if the doctor say, I don't know any diving doctors, do you? Then you have the contact to show them. Okay. When it comes to treatment, I myself use two treatment table only. One is a US Navy diving table 6 and the long treatment table that will probably takes you 5 hours inside the chamber, and then the other one is a shorter table. If you are not so severe, then I'll probably put you in the shorter table treatment that takes about like 2.5 hours like that. So these are the available facilities for you in Malaysia. If you think that you have DCS and you have seen the doctors, and then you need to go to a hyperbaric chamber, most of the hyperbaric chamber in Malaysia are in the military base. And these are the location where you can possibly find a hyperbaric chamber, and that is in Kota Baru, where you have a one-man chamber in Kubang Korean, the university. In Ipoh, there is a private chamber in Greentown. In Lumut has the biggest hyperbaric chamber in the country, because that is the first and the biggest naval base in the country. Kuala Lumpur, we have a number of private hyperbaric chamber, and also our military hyperbaric chamber also is situated in Wangsa Maju Section 2. That was where I was working, and that was my last job before I left the military service. In Kuantan is a naval base, so you can get treatment from there also, because the Navy have the hyperbaric facilities there. Mersing is a commando base. you can get treatment from there also. In Malacca, I'm not sure if the chamber is it working?
There's a chamber, but we do not accept civilians.
Oh, okay, right. So I should cut off the Malacca here and put a cross here. And in Kota Kinabalu, we actually, in the military, in Kota Kinabalu, we actually have the largest number of hyperbaric facilities. We have one on-board ship, it's a submarine rescue ship that is not for civilian. And we have a diver center hyperbaric chamber for the divers, not for civilian also. But in the hospital in Sepangga, Kota Kinabalu, there is hyperbaric facilities. They accept civilian. They work very closely with the Queen Elizabeth Hospital, the emergency department, where I used to work in Kota Kinabalu. We work very closely. Any patient who come from overseas, when they dive in Sabah, then they develop DCS. They go to the emergency department in Queen Elizabeth Hospital, assessed and by the emergency physician, and then if it is not any other things, then they send to me for treatment in my hyperbaric facilities in Sepangga. You have chamber also in Sandakan and Sempona. Sempona is, I think it's a 6-man or 8-man. It's quite a complete, comprehensive facilities. Many divers who went diving there, they get treatment from there. So these are the contact number of the hyperbaric facilities. Okay, in your free time, give them a call and test out the line if it's still working or not, because sometimes they change the phone number without telling us. So take down the number. Okay, everybody have taken the photo. Okay, you don't have to take 2 or 3 photos, just one is enough. You're still taking the lady there. Okay, right. Okay, why do you need to see a diving doctors? Okay, to start off with, in many countries, even before you do an open water divers course, you need to be assessed and checked by a doctor that you are physically fit. You do not have any other disease that will endanger you in the water, and the doctor sign it, then you go for your open water divers. But in Malaysia, we do not have such law. Just like many things in Malaysia, we probably have the law, but we do not enforce it. But in this case, we totally do not have the law. So everybody go diving without seeing a doctors. So when they develop problem, then it traces back to the fact that, oh, this person may not be fit for diving in the first place. So don't take the risk. Diving is not a risk-free activity. It's not like cycling in the Taman Negara, when the worst thing that can happen for you is you fall on the floor and you squash yourself or probably break a bone. But diving is a very risky activities. So better have it checked out by a doctor even before you start diving. Okay, but if you have missed that and you are divers now, it's not too late, because you are still here and you are still alive. And take this opportunity to do a diving medical check, examination, to make sure that you are really fit before you continue diving again. Like Dr. Andrew say, a lot of the diving incidents are not the diving disease or the diving injury itself. It's because of something else. And the majority of the statistic here shows that it's cardiovascular. That means it's a heart-related problem. We eat more and more, and then we exercise less, but then when we see the beautiful coral, we want to dive in, and just like all the other divers, we want to go deeper, longer, and that's how things happen. Okay, so do your medical diving before you continue again. Okay, so why do we need to see a doctor when something already happened, say there is a DCS? Number one is because a doctor can take a detailed history, and from the history, we will know, and when we examine the patient, we will know whether or not this is a true decompression sickness or not. So once we decide this is a decompression sickness, then we know what to do for the patient. We will arrange a treatment for the patient, put them in the hyperbaric facilities, and monitor their progress and the response of treatment until they recover. For me, even after they finish the treatment from my center, I still advise them on how many days you have to stay on land before you take your next flight. Okay, that kind of level. And there was one time I was in touch with my patient in a BlackBerry. The last time, many years ago, we have these BlackBerry messengers. Wow, we are so glamour, got BlackBerry. And then my patient have to fly from Kota Kinabalu to KL, KL to Dubai, Dubai to Munich to Zurich. Many multiple flight, and when she reached Zurich, her home, and that is she's living at the altitude of 1,000 plus meter above sea level. So I monitor her along the flight. Every station when she stopped, she sent me a message telling me that she's okay. And yeah, so we take care of patient up to that kind of level. This is what I do. Okay. Yes, to confirm the diagnosis is very important.
Remember that just because some computer is monitoring what you're doing, don't just listen for the beep. Have a look at it once in a while, right? It does malfunction with all electronic and electrical equipment. Look at your gauges, right? Monitor them periodically. Don't just listen for the beep and ignore that. And most important thing, right? Respect training and instinct. Always tell people, we have gut instinct, right? You don't need to be a doctor, you don't need to be an experienced diver. All of y'all have instinct. If you're not comfortable to dive, if it's not a good day, if you're not feeling well, don't put yourself in a situation where you're going to end up with an injury, okay? And when you're planning your dive, deepest first. Right? So that's something good to remember. And if you've had any proper training, proper certification, you should already know all of these things. This is just a friendly reminder, so to speak. Okay? Now, talking about that, getting certified, very important, right? There are many different people who certify you. Make sure that your certification makes sense as well. Just because you've attended this many hours, if you were sleeping, right? If you were on an island and you decided to go and get a diving certification done, if it's been done within 2 hours, chances are very high not the best certification ever, okay? So think about that as well. If you're going to do specialized diving, wrecks, caves, very nice things to do, very interesting kind of dives, but especially the other one that's very common is also night dives, right? Most people actually advocate this as part of their tourist package, but think about it, right? I mean, the underwater world is nice, very interesting environment to be in, but also something that we have lack of control over. So take away the element of daylight, less control, higher the risk, higher the uncertainty, okay? So when you're diving with a dive buddy, this is the practice that we're all recommended to do. Everyone should have a dive buddy. Remember that you need to be able to communicate with them, right? So onshore communication, on surface communication, communication under the water, try to practice before you go down, right? If you're doing group dives, ideally speaking, this is what we all do nowadays. Try to plan, if you're the person who's planning, plan around the least experienced person, right? So this ensures that the entire group actually has a good time and know what you have to do. Don't just be one of the last people following the pack, right? Make sure that you understand exactly what the dive plan is and listen to your briefings. Something is very common sense as well. Check your equipment, right? Just because you're going in a group, just because you've got, been doing the same dive center many times, doesn't mean that take it for granted. Check your equipment, look at each piece that you're using, make sure that each of it is functioning appropriately at that point in time. Another important thing is that always make sure that you have enough air, okay? This comes back to what we talked about earlier, which is looking at gauges, right? Make sure that you have enough air. The last thing that you want is to have, to be worried about lack of air and try to shoot up to the surface. Dr. Andrew alluded to that, right? Most of the time, instinctively, however many times you've been diving, how experienced you are, you will hold your breath, right? That's the last thing you want to do. Very dangerous. Guarantee you'll have to come and see one of us, and I'll tell you this, we would not want to see you in that situation, right? So another important thing is coming back to marine life, hazardous corals, look out, right? Don't just go around cruising in the water, right? Just like if you were to drive a car, look around you, look at your surroundings, make sure that there is nothing that is a potential harm that is around you, okay? Now, this is very nice. Again, none of this is mine. This is all just been taken off from certain sources on the internet. Good summaries, I feel, for how you should do safe diving practices. You can research it in your own time. Now, this is again adapted from the DAN website. It's a very good resource to go to. Some of the common mistakes that we make, and these are things that actually allude to potential injuries when we are diving, right? So, first of all, neglecting health and fitness. Both the speakers before me have told you that you need to be in some level of fitness. One good way is to see a dive doctor before you dive. If you don't have the opportunity to do that, just make sure that you do regular medical checkups, right? Okay, so that's also important. So health and fitness, not just general health and fitness, but also at that particular time before you dive. Simple things like a flu, an upset stomach, these are all things that we pick up when we travel, right? And all of these can actually compromise because it leads to dehydration, and that can make you at a higher risk to develop DCS. Now, neglecting proper gear maintenance, this is also something that's very common. A vast majority of the time we rent this equipment when we are diving. Make sure that the maintenance is done well. Again, planning. This is a recurrent theme that you're going to hear. Lack of buoyancy control. Now, this is also important because it tends to, if you use your regulator to check your buoyancy all the time, what happens is that you end up with a bounce dive, right? And this is something that can actually lead to DCS at the end of the day. Now, diving beyond your training, very easy to happen because we tend to get, follow the pack, get excited when you're there. Never mind, let me just try. Last thing you want to do, don't just try. Make sure you plan, make sure you're trained, right? Running out of air, more common than you think, because again, when you don't pay attention, very difficult for you to actually anticipate time when you're underwater, right? That's one of the reasons why we dive in the first place. It's very relaxing. You tend to be able to get out of your element a little bit, right? So don't run out of air. Again, common sense logic, and not taking personal responsibility. Now, this is something I think I want to spend a little bit of time on, because I think at the end of the day, right, when you dive, there's always a group effort to get one person under the water. But remember this, when you have a DCS, right, you're the person who is suffering, right? So you want to be personally responsible. Your gear, your maintenance, your dive plan, your environment, your dive buddy as well, right? So don't just rely on somebody else. If you've got no experience in the water, get your experience and then go under, okay? When it comes to dive centers and providers, as you can see around here, there are a lot of people in the business now. How do you choose which one to go to, right? My take on this is logic, common sense, instinct, right? How do you choose a restaurant? Same thing. Logic, common sense, instinct. You want to employ the similar principles, but when it comes to dive centers, because we know that there is a whole host of diseases, injuries that can be associated with this very high-risk activity, these are some of the criteria that you want to entertain when you're choosing your dive center. Basically, think about price and quality, right? We have always been taught that the higher price you pay, the better the quality. Not always true. The reverse is also not always true. Just because it's cheap, it doesn't mean that it is of poor quality, okay? So assess based on what the quality is, and price might not be your only marker. Look at the maintenance, not just of the equipment, but also of the premises, right? A poorly kept center will reflect on their equipment maintenance as well. At the same time, look for qualifications of the people that are taking you under the water. Are your dive instructors well trained? Do they have certification? How long ago were they reassessed? When you see your doctor, we tend to think about where did they graduate from, how many years experience do they have. All of this counts when you're taking, choosing your centers. Look at their records, right? Have they had injuries before? What is their fatalities that they've had before? Is this something that they even keep? So all of these things are important. Check out their safety procedures. Do they have affiliations to dive center, to hyperbaric centers? Are they recognized by some of the places that we know that are focusing on safety of divers, like for example DAN? Do they have a DAN sticker on their premises, right? And also whether or not they have oxygen, right? So this is something that's the cornerstone of safety when it comes to diving, right? How much of oxygen do they carry? What are the tanks that they have? Does it work or not? When was the last time it was serviced? Is there any gas in that tank? That's also very important to think about, right? What are the affiliations that they have? Generally what happens is that when you open up a center, if you're affiliated to one of these big names, they tend to have some checks in place, so you can be rest assured that the safety aspects are taken care of. Look for references, do your research, right? So nowadays, social media, Instagram, Facebook, there are wide variety of resources that you have to do your research. Comes back again to taking personal responsibility. Just because, one person in your entire dive circle recommended might not be the best place. So do your research, check up on them, check to see what their ratings are and what their records are, okay? And most importantly, trust your instinct, okay? If you walk in there and you feel funny, walk down the road, okay? Now, this is something that I want to leave you with, right? Ideally, you shouldn't be seeing any of us unless we are your good friends and we are diving with you, next to you, right? So ounce of prevention, worth a pound in treatment. Thank you.
First of all, I want to say thank you to Dr. Peter, Dr. Andrew, Clement, and Dr. Divya. You don't know me, my name is Dr. Rozan. Right. I've spoken to some of you before. I've got two questions. The first is, do we know a little bit more about this is rather sensitive, the fatality that happened involving the Perak royalty? That, she was diving off Perhentian in the end of March, and I understand there was a boring rupture and then things happened after that. Could you share perhaps, any learnings from that from a diving medicine perspective, if you know? The second question goes to Dr. Clement's comment about instructors sending cases directly to the hyperbaric chambers. Do the hyperbaric chambers not require, aren't they required to have access to a diving medicine physician or someone with diving medicine training in order for them to accept such cases? Two questions.
Okay, I will take the second question. And the first question, we have to go to Dr. Andrew because he's in the government service, so the boss of it. So on the regulation of hyperbaric facilities, whether or not it's required to be manned by a hyperbaric physician, in Malaysia, there's no law. Okay, so as simple as that. In Malaysia, we do not have law. If you have money today, you can go and buy a hyperbaric chamber, we'll set up a clinic, and you can open a shop, and you can provide hyperbaric treatment with no qualification. Then Malaysia is like that. Okay, we have not have any medical council coming to put up any law or rules for that things to happen. So this kind of thing is still happening. It's a little bit unfortunate. So we are trying to be here to make our presence known so that you will get to know us, and then so that you, when you have this problem, you can go through the proper channel. Okay?
Well, for the first question, I think it's too early to talk about that. I can tell you from experience, because then we have special department that does injury monitoring and collecting data on that. And usually it takes up to 1 year to get all facts together, because you have official investigative agency that go about that, medical examiner and so on, and it's not possible in so short period to provide you much more details. But if you want to learn from fatalities and injuries, you have in Dan online thing case summaries of incidents and injuries and fatalities where divers who survived incidents tell you their stories, but also we have case summaries of fatalities that have been investigated thoroughly, and we know what happened there. So don't wait the results of this investigation. You can learn from others bad experiences from our sources. And when it comes to going directly to the chamber, that is the worst thing to do, because chamber can be closed, not qualified. So if you suspect you have injury, call the emergency service, call them. Emergency service will take you to the first medical facility that can evaluate you and provide, stabilize your condition if necessary, and then will put you in touch with specialist physician who will guide your treatment.
Just to carry on with what the doctor there said about seeing a physician and all that, and you yourself, Dr. Clement, you said something about the fact that it is not law to operate a hyperbaric chamber. Having so many dive sites, so many dive places within the peninsula alone, let alone in the eastern side of Malaysia, why has it not happened yet? Why is there no law that has come into place that makes sure that all these rules are followed when using or needing to use a hyperbaric chamber?
I've been involved with diving medicine for nearly 20 years now. What I notice is that all agency, right, irrespective of whether governmental, non-governmental or others, health is always the last in their mind. It's very common. Unless something happened to you, then you worry. Okay? We are biased as we are in medical health. We are health personnel. We think, oh yeah, we should be very important in that sense. But many projects, many things never involve the doctors or the health personnel until somebody suddenly thought about it. It happens many times. So in terms of law, okay, that is a very controversial subject. Okay, for example, I take Australia. Previously, only in Queensland you need a dive medical. Dive medical means a diving medical examination before you can take open water certification, like what Dr. Clement mentioned just now. But even now in Queensland, the law has been repealed. There is no longer a need for you to see a diving doctor first before you take up diving, unless you take yes in one of the questionnaire. That means they push the responsibility to divers. In a sense, I agree, because this is a recreational sport. All right? Tomorrow you can buy a dive tank for any of the dive shop and go diving tomorrow. Nobody can stop you. Okay? So because this is a recreational thing, you must take care of your own health. So the problem we always see is that go to a dive center, they give you a form, health declaration, and they ask you, do you have asthma, do you have hypertension, do you have this and that. I better tick, oh yes, no, otherwise if I put yes, then I wasted my money, isn't it? That is the problem. But we cannot force you. It's different in the military, it's different in the commercial diving world, where it is compulsory. If you don't see your job, my job or his job or whatever, you cannot work. The work today, you sit, you're not going to get paid. So it's different, you see. So whether we should have law or not is very controversial, and generally I agree that there shouldn't be a law. It should be your own responsibility. But if you have problem, then you need to see a doctor. You tick yes, you need to see a doctor. As you are a dive instructor, dive operator, do not be unscrupulous and tell your customer, just tick no, never mind, just tick no. If something happened, you get sued. There are cases already, you get sued.
It's the same like going for mountain climbing. You do not need the medical certification to certify that you are fit to climb a mountain. You can buy a pair of shoes and climb the mountain today. So I think it is our responsibility that if we know that we have some medical issue with us, it is our initiative to go and look for a doctor to get it checked out and to make sure that we are fit before we do that.
So I also understand part of the question is the concern we have some area where there is not enough chamber and so on. I can tell you Malaysia is in better situation with chamber coverage than United States, where there is much more diving. Because it's not necessary always to have chamber right at the spot. It's not possible. And there is very few cases that require recompression in a chamber immediately after the symptom onset. Average time to treatment in the United States is 24 hours. And most of the cases will have no bad effects because they have been delayed. What's more important when it comes to diving injury, that we match patient with the hyperbaric chamber. Not all the patients are the same, of same severity, requiring same level of care, and not all the chamber can provide the same level of care. So it's important to have proper qualification of injury, and that's what specialists like Dr. Clement, Dr. Ang, and Dr. Divya can provide, but also Dan can provide that regardless where you are, and we will find the best chamber for treatment.
You get the skin bends. I haven't been treated, but I get the skin bends. And it seems like it happens more and more, but I use nitrox, and it seems to help. What is it that I can do before or after a dive that would help me to get through that? I don't want to stop diving. I don't go as deep, but is there any kind of thing I can do before or after that would help me?
So how often you have that skin bend? Almost what it looks like? Marbling. So if you have marbling, and there is a nice brochure at the Dan booth over there, you will see what it looks like. If you have that once, okay, it may have happened, but you have it more than once, very likely you have PFO. What's PFO? Patent foraminal. That's one hole in the heart. You've been tested, and it was not there. Then you have to talk to internal medicine specialist who is also a diving medicine specialist, because if you don't have PFO and if you limit the depth of your dive, you use nitrox, and you still are getting that, it may be not DCS, it may be some vasculitis or something that is causing that because of cold water or whatever. Yeah, there are always some exceptions. So this looks like a case that's quite different than anything else. And after 2 sentences, we cannot give you diagnosis. But in general, if you have marbling of skin, mottling of skin after diving, that looks like cutaneous skin decompression illness. Take the picture of that and send it to your physician or to Dan so that they can tell you whether it is or not. This is one of the rare conditions that can be easily diagnosed just by having a look on that. And for the lady that had this question, I can tell, go see Dr. Clement or any of the doctors here, and they will take all the details and be able to advise you properly. So thank you very much for coming, and be sure we will be here again. Thank you. Thank you.